We have a construction worker of 48 years old that is saved after a heavy bar fell onto his right thigh. On the expression of the thigh, he has a right crural lump. According to his colleagues, this crural lump expanded continuously from the moment of the accident. Now he is in the ED. At palpation, the popliteal pulse and the pedial pulse are absent. The patient is stable hemodynamically. What is the best next step in this situation? We perform an emergent surgical exploration. We perform a CT angiography. We perform a 24-hour compression for resorption, or we perform an amputation. This time we have a female of 65 years old that falls from her height. She states that she bled previously at the level of the right antecubital fossa and applied rigorous pressure. The bleeding stopped. The patient now is stable hemodynamically. However, we have a Freddy radial pulse on the right. On the left, the radial pulse is well perceived. What is the best next step in this case? Emergent surgical exploration, CT angiography, 24-hour compression for resorption, or amputation. So the first one is indeed an emergent surgical intervention, whereas the second one is a CT angiography. Why? Well, in the case of vascular injury, we have hard signs and soft signs. The hard signs are represented by the 6 P's: pallor, paresthesias, poikilothermia, meaning that the limb is now colder than normal. There will be pain, pulselessness, and pallor of the limb. Other hard signs of vascular injury are a palpable frill, an expanding hematoma, and absent pulses or active hemorrhage. In the first case of the male, the patient had no pulses at the level of the pedial artery or at the popliteal level. Also, his co-workers stated that the crural lump has expanded, namely his hematoma expanded. So this patient had 2 hard signs that indicated a need for emergent surgical exploration. On the other hand are the soft signs. These are a large non-expandable hematoma, a history of the bleeding at that site, a peripheral nerve deficit, which could be translated by paresthesias in this case, but it is an isolated finding. The pulses are still palpated, however, they are diminished or unequal, or we can have a complex fracture. This was the case of the female, who had a history of bleeding at the level of the antecubital fossa and a Freddy radial pulse, namely it was diminished. We could also consider that she had a complex fracture, but there were no details in the vignette that would indicate this third finding. In the case of soft signs with vascular injury, the next best step is to perform a CT angiography.